It's a webinar on influenza and its prevention, organized by Heathrow. Heathrow Healthcare, as you all know, is an innovative pharmaceutical company. Our journey began in 1993. We have 30 years of excellence and 36 state-of-art manufacturing facilities. 300 plus products in portfolio and presence in 126 plus countries. We have 21,000 employees globally, and we are amongst the largest manufacturers of ARV, APIs, and FDFs in the world. We have Asia's largest manufacturing complex at Visakhapatnam, Andhra Pradesh. Heathrow Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching out to customers across India with wide range of products encompassing multiple specialties, pioneering in quality and innovation, and we have the distinction of bringing four biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Heathrow Healthcare introduced antivirals like oseltamivir, favipiravir, and remdesivir, for which they received an award of Pharma Excellence in August 2020 for COVID drugs. Today's webinar is on influenza and its prevention. There are many papers and documentations and our own experience on influenza and prevention by oseltamivir. To know doctors' insight, to get their insights on the epidemic and on the drug. Today we have got two eminent speakers, Dr. Prashant Chavan and Dr. Nikhil Doke. Welcome, Dr. Prashant Chavan. Welcome, Dr. Nikhil.
Thank you, sir.
Dr. Prashant Chavan is an MBBS DCH DNB with fellowship in pediatric intensive care at PGPN from Boston University. Currently Chief Consultant Pediatrician at Chavan Hospital, Chhatrapati Sambhajinagar. Vice President, Parvati Charitable Hospitals, Chhatrapati Sambhajinagar. Treasurer, Aurangabad Academy of Pediatrics. He has several publications to his credit and has attended several conferences and workshops. Has contributed as speakers both at national faculties and at regional and state level. Once again, welcome, Dr. Prashant. Dr. Nikhil Doke, sir, is MBBS MD Pediatrics, a life member of Indian Academy of Pediatrics. Has teaching experience been assistant professor in V.K. Patil Medical College, Ahmednagar, currently with CSMSS Medical College, Chhatrapati Sambhajinagar. Sir has received awards for poster presentation and breastfeeding promotion committee. Has published paper in Adolescon and has conducted guest lecture on Down syndrome, IMNCI workshop. Has attended has advantage of breastfeeding symposium, conducted workshops on high-risk behavior in adolescent, VPMC, Nasik. Welcome, Dr. Nikhil. And with this brief introduction, I hand over the session to Dr. Nikhil for further deliberation. Welcome, sir.
Thank you for handling over the session. So I will start sharing my slides.
Yes.
Are my slides are visible, sir?
Yes, they are.
Okay. So in today's lecture, we are going to see the empirical use of oseltamivir in flu management. So content of these lectures are healthcare challenges in monsoon and their diagnosis, influenza and its complications, clinical evidence of oseltamivir in flu management, and government guidelines, that is IP guidelines, WHO and CDC guidelines for empirical use of oseltamivir in influenza. So healthcare challenges in monsoon. So monsoon period in India lies between June to September months. In this period, the common illnesses we are noticed are influenza, H1N1, influenza-like illnesses, H1N1, that is flu, and severe acute respiratory illnesses and COVID-19. So this is a study done in Tamil Nadu and published in Indian Journal of Medical Microbiology. And the title of this study is Dynamics of Occurrence of Influenza in Relation with Seasonal Variation in Chennai. It is a 7-year cumulative study. This study done by Department of Virology, King's Institute of Preventive Medicine and Research. In this study, 36,617 specimens were subjected for influenza analysis, and the results were published after 7 years of analysis. And the outcome of this study is the influenza positivity rate starts with the monsoon and peaks during the post-monsoon months. So here is the case burden of influenza year by year, in which in these graphs we have seen the 3 bar diagrams in which the number of cases and number of deaths with the influenza are increasing by year. in 2015 we will get only 4,259 cases. In 2018, 15,266 cases, and in 2019 we have got 28,798 cases, and the deaths are also increasing as the cases increases. So year by year we are getting the more number of flu cases in our country. So here in this slide we are going to see the basics of influenza. So once a minute. So influenza is the most common infectious disease caused by the influenza virus. So it is highly contagious disease and it is transmitted by airborne route. So influenza has seasonal epidemics, that is lies between June and September months, and primarily manifested as the acute febrile illness. So symptoms of the influenza are fever, cough, runny nose, sore throat and body ache, and serious complication of this flu can be result if we don't treat the influenza in early phase, lead to the development of pneumonia, its complication, hospitalization and death. And the clinical picture lies between mild to severe illness. So here we are going to see the types of influenza virus. So mostly in our country we will get the influenza A, B, C and D. So very little thing about influenza A. So it will cause the frequent epidemics due to minor antigenic variation. So in influenza, we have seen the two properties, that is antigenic drift and antigenic shift. So antigenic drift is a minor phenomena in which the slight antigenic variation we can see, and in antigenic shift we will get the completely new strain which will cause the entirely different types of infection in the influenza. So in influenza A, the more periodic pandemics and epidemics we are going to see. And influenza B virus only affect the human and it will cause only local epidemics. It will doesn't cause the more pandemic type of epidemics. Then influenza C, the human, it will affect the humans and swine. Influenza C infection generally causes the mild respiratory illnesses and it will also cause the epidemics. Currently, the circulating human subtypes of influenza are H1N1 and H3N2. That is, H1N1 are swine flu and bird flu types of the influenza viruses. So transmission of flu virus, how the flu transmitted. Flu and influenza are both are the same things. So people with influenza can spread their infection up to the 6 feet away. And the mode of transport of infection is by spread by two droplet routes, by coughing, sneezing or talking. The person who got infected with the influenza, he can spread the infection up to the 6 feet by coughing, sneezing and talking. The droplet can be land in the mouth and nose of the nearby people and they can be inhaled through the lungs, and that is the mode of transmission of influenza. Then people should stay away from the infected person and stay home if they feel sick. That will prevent the further transmission of influenza. Most healthy adults may be able to infect the other adults. That is the incubation period of this influenza, that is lies between first day before symptoms and up to 5 to 7 days after becoming sick. So these are the transmissible period and infectious period for the influenza. And children can be passed this virus for the longer duration for more than 7 days. If the child is infected, he has the greater potential to transmit the infection for the longer duration. So in this table, we will differentiate between the influenza-like illnesses, H1N1, that is influenza, severe acute respiratory infection, and COVID-19. In all these four symptoms, the fever, myalgia, cough, lack of energy, sore throat, all these four are common symptoms. But the breathlessness is more commonly seen in H1N1, severe acute respiratory illness, and COVID-19. And breathlessness plus loss of smell and taste sensation, diarrhea, those are typical feature of COVID-19. So this feature is not seen in influenza-like illnesses, H1N1, and severe acute respiratory illnesses. So these are the emergency warning signs that you have to be recognized in the children for the flu sickness. So in children and the adults, So most common finding that we will get in children are fast breathing, that is increased respiratory rate, difficulty in breathing, bluish discoloration of skin. The term medical term for it is cyanosis. Then not able to drink the fluids, difficulty in drinking the water, not waking up due to lethargy, or being so much irritable. Then the plus flu-like symptom. What are the flu-like symptoms? Fever, myalgia, sore throat, runny nose, red eyes. These are the flu-like symptoms. And fever with rash. So these are the common symptoms that we can get in the children who are infected with the influenza viruses. And plus this, if you see the child is having above symptoms and unable to eat, he has increased respiratory rate with respiratory distress. So respiratory distress means increase in respiratory rate plus subcostal and intercostal retractions. So this is a medical emergency. In this case, you have to directly bring the child to the nearby hospital for the further treatment. In adults, we have getting the same symptoms like difficulty in breathing, pain in chest and abdomen, sudden dizziness, confusion, severe and persistent vomiting, and flu-like symptoms. So we are going to see the complication of influenza. So most common complication of influenza is pneumonia, then followed by bronchiolitis, then ear infection, then worsening of the existing diseases. Suppose the patient is having asthma or COPD, then the symptoms of those diseases are getting worse when the child or person get infected with the influenza, then ARDS, and finally death. These are the common complication of the flu infection. Then management of influenza. So treatment of influenza. So treatment is largely supportive and it will consist of strict bed rest, increased fluid consumption, that is meant by to maintain the hydration in the patient body. Then use of cough suppression, that is meant by antitussive agents, antipyretics, that is non-steroidal anti-inflammatory drugs like paracetamol, and oseltamivir therapy. Most of the patient with the influenza will be recover within 3 days, but however the malaise may be persist for weeks, and severe cases may require the intravenous hydration and other supportive measures like oxygen support and CPAP. So treatment of influenza with the antiviral drugs. So for the treatment of influenza, the most two types of drugs are available in the market, that is neuraminidase inhibitor and adamentinase inhibitor. So neuraminidase inhibitor block the viral neuraminidase enzyme, and that will critical step for release of viruses from infected cells. So neuraminidase inhibit the release of virus from infected cells, and neuraminidase inhibitors act on both types of influenza, that is influenza A and influenza B, and the examples of neuraminidase inhibitors are oseltamivir and zanamivir. And adamentinase inhibitors are act on the hydrogen channel activity of the influenza A virus, and it will block the entry of influenza into host cell. So adamentinase inhibitor only act on influenza A types of viruses, it will not act on influenza B and C. So examples of M2 channel blockers are adamantine and ramantidine. So antiviral therapy with oseltamivir. So oseltamivir. So what is the mechanism of action of oseltamivir? So oseltamivir is a potent selective inhibitor of neuraminidase enzyme. So it will block the neuraminidase enzyme of the viron. So it will doesn't come out from the infected host cell to the rest of the body. Oseltamivir is a product and which will be get converted into its active form. The active form of oseltamivir is oseltamivir carboxylate, and this conversion take place in the liver. Then it will inhibit the influenza virus by replication and pathogenicity. So oseltamivir inhibit the replication and pathogenicity of the virus, and it will also prevent the further spread of the viral infection throughout the body by blocking the virus coming out from the infected cell. And oseltamivir is effective against all strains of influenza, that is influenza B, A, H5N1, swine flu, H1N1, H9N2, and all these minor antigenic variations. So oseltamivir act on most of the strain of influenza viruses. It will cover influenza A infection, influenza B infection, influenza C infection, and all these minute strain variations. So here we will discuss the mechanism of action of oseltamivir. So oseltamivir is a neuraminidase inhibitor. So neuraminidase is an enzyme which is responsible for coming out of infected virus from the infected cell. So neuraminidase act on neuraminidase enzyme, and that will block the viron release from the infected cell, and that will inhibit the further spread of the virus inside the human body. So oseltamivir is the first oral drug that will be approved by FDA, CDC, American Academy of Pediatrics, and Indian Academy of Pediatrics. So oseltamivir is available in more than 100 countries all over the world. So here we are going to discuss the dosage and recommendation of use of oseltamivir in the influenza management. So the oseltamivir use is depend upon the different regimen. That is, oseltamivir treatment for post-infection is given for 5 days. Then oseltamivir prophylaxis are given for 10 days. And in immunocompromised patient, the treatment duration is for 12 weeks. In for treatment of influenza in adults, 70 mg capsules are available, which can be administered twice daily for 5 to 10 days, depending upon the infection scenario. Then in children, the different weight bands are there. So less than 15 kg, we can give 60 mg per kg in 2 divided doses, and up to 15 to 23 kg in 90 mg per kg in 2 divided doses, 23 to 40, 120 mg per day, and these are the different weight bands of administration of oseltamivir in pediatric age group. Normally, we will give the 3 mg per kg dose, and the most common formulation available for pediatricians is syrup oseltamivir 12 mg per ml. So treatment of oseltamivir should be started within 48 hours of suspension of the infection. Then only the outcome of the case are good. So here I will discuss the some clinical cases that we are encountered in our OPD and IPD. So case 1. So here the 5-year-old male having weight of 18 kg with no significant medical history came to us with the symptoms of fever 102 degree Fahrenheit and cough, fatigue, and nasal congestion for 1 day. We have done the diagnosis of influenza by rapid influenza diagnostics test. But please remember, the starting of oseltamivir does not require the your microbiological diagnosis. You can directly start oseltamivir. That is meant by empirical treatment. Only suspicion of the influenza or influenza-like illnesses, you can directly start the oseltamivir. But here, due to availability of the facility, we can done rapid influenza diagnostic test and confirm the case of influenza A. Then we have done the CXR. The picture of CXR, chest X-ray, I will show you after this slide. And the X-ray picture suggestive of the ground glass opacity, that is suggestive of influenza. In this case, we have started the oseltamivir 30 mg twice daily for 5 days oral suspension, and some symptomatic treatment like antitussive and paracetamol. So treatment started within 24 hours of starting of symptoms in this case. And the first day the fever is reduced, second day further reduction of the fever, day 3 and day 4 marked improvement in nasal congestion and energy level. Child is getting happier or energetic. And day 5 full resolution of symptoms and no side effects are reported with the influenza case. So here we have used the only oseltamivir, and it will be effective in treating influenza A infection in 5-year-old children when we have started the influenza treatment within 48 hours of the appearance of the symptoms, and it will decreases the severity and duration of hospital stay in this case. So here I have shown you, this is the X-ray of same child before starting the oseltamivir treatment, and this is X-ray done after 5 days of starting oseltamivir treatment. So you can clearly notice there is a ground glass opacity and patchy infiltrate all over the lung field. And after starting of oseltamivir treatment, there is a complete clearance of lung field in this child. So here I will discuss my second case. So 7-year-old female, weight is 23 kg, came to us with the chief complaints of fever 101 degree Fahrenheit, sore throat, body ache, and cough for 1 day. We have done the rapid influenza diagnostic test that will be came positive with influenza A. X-ray test was done that is also suggestive of ground glass opacity and it will suggestive of influenza. So we have started the treatment with the 45 mg twice daily for 5 days. Oral suspension therapy is started within 18 hours of symptom onset, and after starting the treatment in day 2 fever resolved, reduction in body ache seen, and day 4 cough and sore throat significantly improved, and day 5 complete recovery of the child with no adverse effect are noticed with the influenza treatment or with the oseltamivir treatment. So conclusion in this case is oseltamivir effectively manage the influenza symptom in 7-year-old children on weight-based dosing and early initiation of therapy are the crucial role to quick recovery and decrease the hospital stay in this case. So here is the chest X-ray. In this X-ray, we have seen the some patchy opacity and ground glass opacity, and after 5 days, the same X-ray repeated, or and it will see the clearance of lung field. Oseltamivir treatment in the influenza illness reduces the lower respiratory tract infection, antibiotic use, and hospitalization. So here I will discuss the study which will be published in Archives of Internal Medicine in 2003. So it was a prospective study. So it will be done on 3,564 subjects, and those subjects are grouped according to the age wise 13 to 19 years of age band and with the influenza like illnesses, and they are divided into two, in placebo and controlled, and it will double blinded clinical trial. And in first group the oseltamivir is given and second group the placebo are given. In the oseltamivir group we have seen the and reduction of antibiotic use by 26%, influenza related lower respiratory tract infection, that is the development of pneumonia, are decreased in 55%, and decrease of the hospital duration in 60%, nearly 59 to 60% in this case study. So reducing occurrence and severity of pneumonia due to H1N1 by early oseltamivir administration. So here the second study that's also published in PLOS1 journal, and it will be done on 442 patients. Median time of symptom of onset of oseltamivir was 5 days. So minimum duration of treatment or mean duration of treatment given for 5 days, and subjects were divided into the groups of days of administration of the oseltamivir, that is less than 2 days, 3 to 7 days, 8 to 14 days, and more than 14 days. And here is the outcome of this study. So in first graph we are going to see the y-axis which will show the probability of development of pneumonia, and time, and x-axis we have seen the time from symptom onset. So early initiation of oseltamivir treatment will be reduce the development of the pneumonia and severe type of pneumonia. And again, if we are given the oseltamivir after 48 hours of treatment, it can also prevent to the considerable potential to reduce the development of the pneumonia and severe types of pneumonia. That is the outcome of this graph. And there is a second graph which will show the days in y-axis we have seen the rate of hospital discharge, and in x-axis we have seen the days of hospitalization. So in this study, after administration of oseltamivir, it will decreases the duration of hospital stay and early discharges. So we are going to see now the government guidelines and recommendation to use the oseltamivir. So WHO recommendation. So WHO recommend the empiric treatment that is strongly recommended by WHO. Treatment should be started as soon as possible. Laboratory confirmation of influenza virus infection is not necessary for initiation of treatment. That is said by WHO. So please start the oseltamivir treatment as soon as possible within 48 hours when you get a child with the complaint of fever, sore throat, and flu-like illness like myalgia. In this case, you have to start oseltamivir as early as possible. That is recommended by WHO. So, and again, the WHO recommend the negative laboratory test for H1N1 does not exclude the diagnosis. Okay, so child could have the influenza infection, and that can be missed by some rapid influenza diagnostic test. So, starting of oseltamivir is must, irrespective of your lab-based diagnosis. Based on your clinical diagnosis, you can start the oseltamivir, and oseltamivir has excellent results. So if the higher risk of individual have been exposed to the patient with influenza, consider the presumptive treatment with the oseltamivir that I have already discussed. So here the Ministry of Health and Family Welfare Department, that is Government Department of India guidelines. So what these guidelines are saying, empirical antibiotic treatment should be based on clinical diagnosis, not based on your lab diagnosis. So community acquired pneumonia, healthcare associated pneumonia, and sepsis. In those conditions, empirical therapy with neuraminidase inhibitor. So neuraminidase inhibitor like oseltamivir is started when there is suspension for influenza. So summary of all this presentation is here. Proper diagnosis of influenza is must, not based on your lab diagnosis, based on your clinical diagnosis. So symptoms and your clinical findings. If that supports the influenza diagnosis, please start the oseltamivir treatment as early as possible within a 48 hours. So results of influenza recovery are very good when you start the treatment within 48 hours. And if you start the treatment after 48 hours, then also the outcomes are good, but not to the extent of that is when you start the influenza treatment within 48 hours with the oseltamivir. Empiric use of oseltamivir reduces the lower respiratory tract infections like pneumonia, bronchiolitis, severe types of pneumonia, need of CPAP, need of oxygen therapy. All these complications can be reduced by use of oseltamivir within a 48 hours in the patient of influenza. WHO, American Thoracic Society, and Ministry of Health and Family Welfare, Government of India Department, and Indian Academy of Pediatrics also recommend the use of influenza, that is fluvir syrup, that is oseltamivir syrup in the influenza management. So thank you.
Thanks, Dr. Nikhil. It was a lovely presentation. Good insights we got, especially from the case studies. Thank you very much. Now I request Dr. Prashant to take over.
Thank you, sir. Very nice illustration and presentation
Yes.
our Nikhil sir. Now I will directly share some of my cases there. Yes. So can you see my screen?
So can you make it in the I mean that the presentation mode, because this is where you can see but not very big.
Yes, I will do that.
Yes, but you can see that. Now it's very clear.
Thank you. Yes. So what is the Dr. Nikhil was saying, what are the guidelines, international and national guidelines? We can see here. So these are the guidelines given to us in 2022 that by Indian Academy of Pediatrics, standard complete guidelines given where they have mentioned the use of this oseltamivir and what all the management should be there for your children. Again, these are the recommendations recently given, and these are the current recommendations that is still applicable in the treatment and prevention of influenza in children. So these are the American Academy of Pediatrics. We do almost similarly. We are also in Indian standards. We are following them. So these are the few of the guidelines that Dr. Nikhil was telling and quoting. So what they are saying is the oseltamivir is the only preferred antiviral drug at present for the treatment of influenza A and B both, because the cumulative experience of this drug in children related to cost and ease of administration is very good. And as Nikhil was saying, we should be started as soon as possible, as we most of the time we know what is the trend going in our nearby area. And that's why we can start early if you see multiple of the patients coming to our OPD with same symptoms. So it should be offered as early as possible, regardless of influenza vaccination status and duration of symptom. That is very important. Most of the time people say कि नहीं हमने vaccination ले लिया है, तो there is no need of doing. So any suspected or confirmed case of influenza disease, any child with severe uncomplicated or uncomplicated progressive influenza disease, regardless of healthcare setting. So यहाँ ये चीज is very important that whether you are in the inpatient department or in outpatient department, you can start your influenza. I am just giving the crux of the guidelines that all these are there. So any suspected or confirmed case of influenza disease, if any of any severity, if they are at high risk of developing influenza complication, regardless of healthcare setting like inpatient or outpatient, you should start with the oseltamivir treatment. So these are the few of the general journals where they have studied the effect of oseltamivir starting within 24 hours of onset of symptom. So this is our age group that we are going to treat 1 to 3 years of age, where they have taken randomized controlled trials and found that it is a very effective drug. If you start, there is a substantial benefit to children with influenza infection. So these are the important some of the articles. So this is the very important meta-analysis that you can see here from they have analyzed data almost of 13 years. They have seen that there is a improved outcome in hospitalized children with oseltamivir. So huge data and huge studies have been done earlier initially also. So now again, few of the case studies, typical presentation that you may see in your cases or hospital also. So 6-year-old male, no significant past history, received standard vaccination, including annual influenza vaccine. Presented with fever, cough, fatigue for last 2 days. Recent confirmed cases of flu in community, as I told you. So yeah, what is the trend going all around your OPD and IPD? You will very well know, and so you can know the what to start and when to start oseltamivir as antiviral drug. Temperature is 102, respiratory is 22 per minute, pulse is 110. So reliably a stable child. He has a complaint of sore throat, myalgia, mild nasal congestion, no significant respiratory distress. A diagnostic test done with RIDT is positive for influenza A vaccine. So we have started with treatment of oseltamivir with a standard dose for 5 days, twice a day. In addition to that, symptomatic treatment like adequate hydration, paracetamol, and rest we have given. On day 2 only, within 24 to 40 hours, there is significant reduction in fever, myalgia. On day 4, there is complete resolution of fever and mild residual cough was there. On day 6, you can see there is a full recovery and he has resumed normal activities. So there are no adverse side effects reported with this standard drug. So we'll move on to case number 2. Here you can see that 4-year-old female child, history of asthma, known case of asthma, and she is on inhaled corticosteroid. No prior hospitalization till date. Vaccinated but missed last year influenza vaccine. Presented with high grade fever, persistent cough, shortness of breath since last 3 days. Temperature 103, RR is tachypneic, heart rate is more, and room air saturation is borderline. Bilateral crackles on lower lung zones. Mild nasal flaring is there, and intercostal retraction indicating of initial stages of respiratory distress. Laboratory tests searched of leukocytosis, lymphocytic predominance, CRP is mildly elevated. X-ray we have done. Cyst of bilateral patchy infiltrates consistent with the viral pneumonia. Nasopharyngeal swab sent for RT-PCR and it was positive for RT-PCR influenza A. You can see there is a initial stages of viral pneumonia, influenza pneumonia. Some intercostal fullness is present, as this is case of asthma. Patient was admitted to pediatric ward. Diagnosis was influenza A, viral pneumonia with secondary bacterial pneumonia, viral pneumonia. All symptoms were started. O2 by nasal cannula to target saturation more than 94. Paracetamol for fever, myalgia. Salbutamol nebulization for asthma exacerbation. IV fluid was given to maintain proper hydration, as there was a reduced intake also. We have done the continuous SpO2 monitoring, vital monitoring was done. On day 1 on the end of day 2nd, fever was there, but improved oxygen saturation with nasal cannula. Tachypnea was reduced. Fever on day 3rd, day 4th, fever was reduced. Significant improvement in breathing. Oxygen was removed and patient was now comfortably breathing with room air. Complete resolution of symptom on day 5, day 6. On day 7, patient was discharged on stable condition and advised to follow with asthma control therapy and follow vaccination. So there are some challenges in APD management. Complicated influenza cases are coming like viral pneumonia, require aggressive management and monitoring. In this case, there is a somewhat delayed presentation, like more than 3 days of symptoms were there initially. So even such cases also, also never has showed the efficacy, and disease progression was reduced. Secondary asthma exacerbation, influenza commonly worsen the pre-existing respiratory condition necessitating the bronchodilator therapy. तो ये आपको ध्यान में रखना है, प्री एग्जिस्टिंग कंडीशन कुछ है तो उसके साथ उसकी भी ट्रीटमेंट करना काफी जरूरी, लाइक ब्रोंकोडायलेटर, inhaled corticosteroids and all. Third case we will see 10-year-old female, recurrent respiratory infections, but not diagnosed with any chronic condition. No history of influenza vaccination. Patient presented with persistent fever, severe cough, progressive difficulty in breathing for last 4 days. On examination, fever was there, tachypnea was there, heart rate is more, tachycardia, and saturation is way less than 90 on room air. There is a intercostal retraction, nasal flaring, auscultation. There were diffuse crackles, wheezing in both lung fluid. Patient was alert but was fatigued. CRP is elevated. SpO2, EBG we have done where PO2 is 60, waterline. PCO2 is 45 more. pH is maintained. CBC searched of leukocytosis with lymphocytic predominance. We have sent the RT-PCR for influenza A, which was positive. X-ray searched of bilateral diffuse infiltrate consistent with the viral pneumonia. And there are some initial changes of early ARDS. You can see there, whiteout is, you can clearly see initial changes of ARDS, O2 dependency, less saturation. Patient was transferred to PICU for respiratory support and monitoring. Also time we have started high flow nasal cannula was started at 40% FiO2. Now it was not maintained on this, so it was shifted to non-invasive ventilation due to worsening of hypoxia, and efforts were there. So we have given proper, somewhat positive pressure also with NIV. Fever, paracetamol we have managed. IV fluid for hydration and maintaining perfusion. We are monitoring patient with serial ABGs and pulse ox monitoring also was done. And we were planning to give mechanical ventilation if NIV was going to fail. Empiric antibiotic broad spectrum ceftriaxone was started to rule out any complementary or secondary bacterial infection. Bronchodilators like salbutamol was used to reduce the bronchospasm like wheezing. How patient progressed on day 1 or 2, there was a persistent tachypnea, O2 requirement was there. She was maintaining on NIV with 60% FiO2, which was fever also gradually subsided. On day 4, see there is significant improvement in oxygen saturation. Effort was we are able to reduce less than 40%, around 40. Saturation was for more than 40%. Patient was transferred back to high flow nasal cannula. On day 5, day 6, breathing was normalized. Oxygen support was removed. Patient was started oral feeding, normal activities. On day 7, patient was discharged with instruction to close follow-up and influenza vaccination for next season. So what are the challenges in such cases? Rapid progression to ARDS is very common in complicated cases, and we need to escalate the respiratory support, and continuous ABG monitoring, vital monitoring is very important. Start with oseltamivir as soon as possible. We have started on day 4. Maybe the addition of this oseltamivir have further prevented the worsening of respiratory symptom. Impaired antibiotic we need to add in such bad cases of ARDS and O2 dependent cases, until you will either get blood culture negative or you definitely rule out the super infections. What is the role of oseltamivir in such cases? It reduces the viral replication, limits the progression of lung injury, thereby start the healing. A recovery time decreases, allowing earlier weaning from respiratory support. So, in summary, we have seen these cases. Proper diagnosis and early treatment can prevent the flu complication. Empiric use of oseltamivir reduces the lower respiratory tract complication, hospitalization, and antibiotic use. And we have seen not only WHO, American Thoracic Society, Ministry of Health and Family Welfare, AAP, American Academy of Pediatrics also, and Indian Academy of Pediatrics also recommend the use of this empirical use of oseltamivir in cases where you suspect the influenza-like illness. Thank you. If you have any questions, you can ask. We can
Thanks,
further
Dr.
discuss.
Prashant. One thing I've noticed, sir, in our time, I'm talking about in my medical college days, bacterial infections were more common than than viral infections or fungal infections. Today, I'm seeing a changing pattern of microbiological, infections. Viral infections are becoming more and more common. And superadded, earlier time it was bacterial infection, superadded viral. Now it is viral infection with superadded bacterial. Exactly.
Correct, sir. Correct.
True, sir.
Very well noticed, sir. And
Yes.
that's why even in my OPD also, we try to prevent giving directly antibiotics.
Correct.
On the other side, in recent few years, we have started also giving the antivirals on OPD basis.
Very correct.
And,
Very correct.
almost, and it has shown very good effects.
I can see from the cases, the patient responding as fast as within 1-2 days.
Yes.
And children responding is actually responding because, they
And
are not.
currently also, nowadays also, we witness lots of cases viral pneumonia. I have 4 to 5 admission at present in my hospital right now also of viral pneumonia, and
Right.
severe myalgia is there, headache is there, fever is persisting more than 5 to 6 days. And if you early pick them and start with the antiviral therapy like oseltamivir, you get wonderful result.
Yes, correct.
And there are the clusters of cases like mother is sick, father is sick, elder sibling, younger sibling was sick. So you get a clue that is a typical viral that is in complete family.
Yes. And it's viral infection happening across like in all the age group, and not only respiratory, even skin, dermatology, everywhere this viral has become more, the changing pattern of microbiology finally.
And at least we have very good drug
Correct.
for this virus influenza like illnesses.
Correct.
And it is working like wonders.
Wonderful. Thank you. It was a lovely, we benefited. I'm sure the doctors must have benefited. The cases were excellent. Dr. Nikhil, खूप छान are the cases. Dr. Prashant.
Thank you, sir. Thank you, sir.
Yes. Since there are no questions, if there are any questions, we'll come back to you, sir.
Definitely.
Yes. And thanks, for all the doctors who took time from their schedule and attended this. I'm sure you got good insights into the changing patterns of microbiology, I'll say. And thank you, marketing and sales team of Hitro, for organizing this and giving us a chance to listen to doctors' insights. Last but not the least, thank you, IT team Hitro, for your support. Thanks, all of you. Signing off. Wish you a very pleasant weekend and have a great evening. Thank you.
Thank you, sir.
Thank you. Thank you.
Can I leave, sir?
लॉग आउट करा सर.
Yes, sir. Thank you, sir.
थँक्यू.